A hip replacement, it's one of the most common surgeries out there, right? But behind that familiar procedure is a really complex and costly financial journey. So today, we're going to follow the money, specifically your taxpayer dollars, to uncover the surprising, real cost of this operation.
So let's just jump right in with the big question. When it's public money on the line, what's the actual price tag for one of these procedures? As you're about to see, the answer is, well, it's probably a lot higher than you'd guess.
In many cases, we're looking at a total cost that can hit $40,000 for a single surgery. Now, that's a huge amount of public money. But the really fascinating part isn't just the total cost. It's where all that money actually goes.
And this is where things get really, really interesting. The official fee that a surgeon gets, the part of the bill you might actually see, is just the tip of the iceberg. We're talking maybe $2,000. But beneath the surface, there are a bunch of completely legal financial pathways that can let that same surgeon's total take-home pay climb to $8,000 or more from just one single case. So how is that even possible?
To understand this, we literally have to follow the taxpayer dollar on its journey. And let me be really clear, this is not a story about fraud or anything legal. It's a look at how public money gets channeled into a system that is specifically designed to generate massive private profit. And that right there is the crucial point. The system we're exploring, it operates exactly as it's meant to. It's all built on a foundation of what are called structural incentives, which are basically just rules designed to keep prices high, margins high, and compensation high for the private players inside the healthcare industry.
So what do we even mean by structural incentives? Honestly, the best way to think of it is like a pipeline that was created by policy. Public money from programs like Medicare gets poured in one end. The pipeline then directs that money through a system that is specifically built to keep prices jacked up, making sure that profits flow right out the other end to private companies and individuals.
So if we're looking at a $40,000 pie, who's getting a slice? Well, there are several key players who are benefiting from this pipeline. Let's break them down one by one.
First up, we have the companies that actually manufacture the artificial hip joint itself. These orthopedic device makers are often the biggest winners in this entire setup. You see, the market for these devices is dominated by just a few huge players. The implants they make can cost anywhere from $3,000 to over $10,000 each. And here's the kicker. Because Medicare doesn't directly negotiate the prices for these devices, these companies can keep their gross profit margins incredibly high. We're talking 60 to 70%. It's just wild. Okay, let's move on to our next player, because this is where the story starts to build. We've got the facilities where these surgeries are more and more often performed. They're called ambulatory surgery centers, or ASCs, and very often they're owned, at least in part, by the surgeons themselves. You see, when a surgeon has an ownership stake in the center, they don't just get paid for doing the surgery, they also get a cut of the facility's overall profits through dividends. This creates a really powerful incentive to do more procedures, especially the ones that are priced higher, because it directly boosts the center's revenue and, of course, their own personal income. Now, of course, we also have the hospitals. While a lot of these procedures are moving over to those outpatient centers, hospitals are still a major player in this whole system. Hospitals also bill for really big facility fees, and they can mark up the price of the implants. And even though they face more cost pressures than the other players, the fixed payment rates for Medicare can still end up being higher than their actual costs, which generates a surplus. And it's a good time to remember, nonprofit status doesn't mean no profit. It just means any surplus gets reinvested instead of paid out to shareholders. So this brings us right back to the surgeon and that surprising gap we saw at the beginning. To really understand how their take-home pay can be so much higher than that official fee, we need to unpack the multiple layers of income they can get from just one hip replacement. So here it is. A surgeon can get paid in 3 different ways. First, there's the professional fee, for actually doing the operation. Second, if they own a piece of the surgery center, they get a share of that facility's profit. And third, they can get royalties and consulting fees from the device makers, especially if they helped design an implant or are just a really high-volume user of their products. This chart really puts it all into perspective. In a realistic scenario, that professional fee, the part most of us think of as the surgeon's payment, is often the smallest piece of the pie. The biggest portions actually come from their ownership share in the surgery center and those financial ties to the device companies. Let's look at the hard numbers. On the low end, maybe for a Medicare patient, the total might be around $3,000. But in a more realistic blended scenario, you combine that fee with the ASC profit and the device money, and the total per case jumps to between $5,000 and $7,000. And in high-end cases, it can easily go past $12,000 for a single hip replacement.
So, what's the ultimate price of a system that's designed this way? And more importantly, why does any of this matter to you as a taxpayer?
Well, when you start multiplying that per case income by the number of surgeries a busy surgeon does in a year, we're talking maybe 150 to 300 surgeries, the numbers just become staggering. A joint replacement specialist who is tapping into these different income streams can easily clear $500,000 to over $1 million per year. So let's just recap the whole system at work. Public taxpayer dollars go in. A pipeline, which was designed by policy, directs that money to private entities. This creates aligned incentives for the device makers and the facility owners to keep prices high. And the most important thing to remember is that all of this is perfectly legal. This is the system working exactly as it was designed to.
Which leaves us with a final and pretty crucial question. If the system is working exactly as it was designed to produce these profits, what would it actually take to change the design itself? It's a question that gets to the absolute heart of how we pay for healthcare in America. Thanks for joining us for this explainer.